I don't. Okay. I'm going to give you guys just a few minutes to get in and get settled. I'll talk about the interactive part of this in just a second, but I just want to introduce myself. I'm Emmy Hartsfield. I live in Tallahassee, Florida. I am a nurse practitioner. I spent 12 years in the clinic and mostly doing women's health. We were an all-female practice, so saw lots of women. And I have three boys. They keep me very busy, so I totally get the busy mom life and not having a ton of extra time to figure all this out health-wise. But I left conventional medicine because I just got really discouraged with how, I would see women in the clinic for physicals and they were talking about brain fog and fatigue and weight gain and anxiety. And the only thing I had to offer was, well, you're due for your mammogram or you're due for your next pap smear. And it was frustrating. That's not why I went into medicine. I wanted to help people feel better. Um, so I started studying functional medicine, and my mind has been blown. The patients that I'm able to work with now, I work with everyone one-on-one, in addition to what I'll present to you today. But the outcomes are incredible, and it's rewarding because I'm actually able to help women get to the root of hormone imbalance and stubborn weight and fatigue and brain fog and all that kind of stuff. So we're going to talk about a lot of that as we go through today. But what I was saying in the beginning is this is an interactive webinar, so I want you guys to have your chat pulled up. I want you to get a lot out of this. I want to help you put the pieces together. I don't want to just be like giving a presentation. That's not fun, boring, and you're not going to really learn a ton from that. I'm going to go ahead and share my screen and we'll get started. I also want to be respectful of everyone's time. If you have questions, you can type them into the chat. Let's try to save the questions for the end. If you have to, I know everyone can't stay the whole time, but if you have questions, try to save them for the end. Unless you have to go, then you can pop them in the chat and I'll go back through and answer everything. And everyone will be getting a copy of the recording. So just FYI. Okay, here we go. I got to get my window in a place that it's not in my way. Let's see. Okay. I feel like Zoom is the hardest to figure out. Okay, so we're going to talk about what I call the triad of chaos and why women really have such a hard time. And I think sometimes we feel like that, and this is just validating. Yes, women struggle more. What we're specifically going to talk about is the hidden connection between what's in your gut and what your hormones are doing or not doing. This is interactive. We're going to talk about the different challenges that most of us face and how to fix it. And the more interactive you are, the more you're going to get out of it. So when we talk about the triad of chaos, we're really talking about how hidden inflammation is hijacking hormones. And it's three big things that we'll talk about with this, what I call the triad or the triangle. And it's gut pathogens, what's living in the gut microbiome, inflammation, and that leads to hormone dysfunction. And then this cycle just perpetuates itself. So it just kind of continues to go around and around. All right, so this is the first time you're going to need the chat. I want you guys to let me know. Does this sound familiar? Do you feel like your body betrayed you after 35? You feel exhausted, you're having weight gain, mood swings, you feel like you're doing everything right, and you still don't feel like yourself. Okay, I see some yeses popping up. What I want you to know is that you're not alone. It's not aging. It's not weakness. It's not motherhood. It's not willpower. The real culprit is that your hormones are legitimately under attack by the triad that I just talked about. And we're going to get a lot further into that as we go. This is something that I find very interesting, and that is, hold on just a second. I have to figure out where to put this. Okay. 75% of women over the age of 35 struggle with what they would consider hormone imbalance symptoms. 80% of women say that it's getting worse, not improving. And 85% are told that their labs are normal, that this is a normal part of aging. You have kids, things aren't going to be the same, but they feel terrible. And the truth is that your hormone disruption is not just getting older. It's not just being a mom or having kids or a stressful job. There is a hidden triad that's systematically destroying your endocrine system. And that's what we are going to go through today. So get the chat out, and I want you guys to tell me which symptom resonates the most. Is it type of number one if it's exhaustion, that you're exhausted no matter how much you sleep? Type two in the chat if it's weight gain, specifically like that stubborn belly and like hip fat that won't budge. Type three if it's PMS hell, so mood swings, cravings, feel like your mood is all over the place. Maybe you feel like you have one good week of the month and the rest of the time things are crazy. Type four if it's brain fog, so you feel foggy, difficulty concentrating. And type five if it's low libido. And it can be several of these. So just tell me what you guys are feeling. Let me bring the chat up. All right, so three and four, three, four, and five, three and five. Yeah. So a lot of times it's going to be several of these. So tell me, Carly says three and five. Yes, and we're going to talk more about PMS and why it's not something that should just be treated with birth control pills and things like that. Three, four, and five. Okay, awesome. Who else? Who else is here and with me? Type those numbers in the chat. That's going to help me see what's going on in your specific situation. Carly also says major anxiety. Okay. All right, so let's look at, Cindy says 1, 2, 5, and 4. Let's look at the symptoms and the pattern that we see here and the triad that I call this, and why doctors really aren't talking about it. I didn't know any of this stuff when I was in conventional medicine. I mean, I knew like some basics, but I didn't realize how much it really does affect everything until I started studying this and working one-on-one with clients and really seeing it firsthand. So first we get the gut dysfunction and gut pathogens. We're going to talk more about what those pathogens are. They create systemic inflammation. Do you ever feel like you just feel like inflamed, like puffy, and you're like, what is going on? I feel like I'm doing everything right, but I feel inflamed. That drives this chronic low-grade inflammation. Remember that inflammation is not necessarily a bad thing. That is an appropriate response to injury or illness, but when it becomes this chronic low-grade inflammation, it is not helpful. So it blocks hormone receptors in production, and that creates more dysfunction. The cycle accelerates, and it really does like go in this circle, triangle, like continuing to affect each other. Here, if you don't take anything else away from this workshop today, I want you to know that you cannot fix your hormones without fixing gut and inflammation. And I see case after case, woman after woman that I work with that has either been thinking about trying hormone replacement therapy or has tried hormone replacement therapy, and they maybe get better for a short period of time and then they're right back where they are. And we'll talk about why some of that stuff can actually be contributing to some of this. So what I want to do first is kind of think back in the functional medicine model. We want to sit down with the patient and look at the timeline. I don't just care what happened last week. I want to think like what happened like 6 months, even like a year ago. And most of the time we can find a trigger. Sometimes it's several triggers, but we're going to go through what some of the common triggers are. So number one would be birth control or antibiotics. So a lot of times I hear like I was fine until I took this round of antibiotics and then everything unraveled after that. And sometimes being on birth control for a long period of time, we'll see this as well. So as I go through this, just kind of listen, take notes, and then put in the chat what you feel like it was that kind of triggered your symptoms. Number two is digestive issues. So around the time that you started having maybe some stomach issues, more bloating, constipation, feel like you're sensitive to foods and it's kind of hard to put your finger on, that you then noticed, gosh, I have this brain fog, I'm anxious, I have, stubborn weight around the middle. Maybe you started noticing fatigue, joint pain, even like autoimmune conditions will come up. And sometimes with autoimmune conditions, it's like, you'll have some positive autoimmune markers, but, maybe you get sent to a rheumatologist and they can't really put their finger on it. And then 4 would be some sort of emotional trauma. So a divorce, a toxic relationship, caregiving, stress. and 5, toxin exposure. So maybe you were exposed to mold or a specific environmental trigger. And after that is when you feel like, yeah, if I really stop and think about it, after this happened, things really started to change. So let me know in the chat which one of these you feel like, if you had to pick one, what do you think is the most significant for you? So we have a 3, a 2. Who else? And sometimes we really have to like stop and think back. We don't necessarily put it together right away, but I do want you to take a few minutes and think back and see if you can kind of figure out where it was. So Cindy said 3. Anyone else? Carly said 1, 4, and 5. Yeah, and it can absolutely be several things. So 1, 4, and 5. Yep. 5, toxin exposure. 4. Yeah, and I will say, like, as a provider, when I'm sitting down talking to patients, a lot of times it is several things, like a round of antibiotics. You found out that the office you're working in has mold and you're going through a divorce. That's like the, like a classic kind of triad. Megan says 4. Okay, I'm going to keep moving on to keep us going, but you guys, please tell me in the chat what you feel like the trigger was. So let's talk about the whole cascade and really how it has an effect on your hormones. So we have a trigger event. So maybe it's the antibiotics, stress, toxins, trauma. Then we get a breakdown of the gut barrier. This creates what we call leaky gut. That's kind of a trending term. You guys will hear about that. But basically, the junctions in the intestinal wall that should be tight become loose and leaky. And this accelerates pathogen overgrowth and triggers a systemic inflammation and immune response. So your immune system is on high alert. This is where we see things like autoimmune conditions develop. And then we start to get the hormone disruption. So we have the blocked hormone receptors, the production of different hormones are impaired, and symptom explosion. So we get the fatigue, the weight gain, the depression, anxiety, brain fog, all the things. And this is where we'll really hear women say, I just don't feel like myself. Sometimes they can't even describe exactly what symptom they feel. They just know that they don't feel like themselves. When your body's stuck in the inflammatory cycle, conventional medicine is only treating the symptoms. So maybe you're taking an anti-inflammatory or an SSRI for anxiety, and we're putting a band-aid on that. So I like to describe it as like putting out the fire without, or turning off the fire alarm without putting out the fire. So until we really get to the root and figure out what is driving this, you're going to continue to have symptom after symptom, new things come up, and that's what we want to get ahead of. That's what the functional medicine model is all about. All right, so I want you guys to share with me in the chat where you feel it the most. So type 1 if you feel it in your head. So that would be like brain fog, headaches, anxiety, depression, mood changes. Type 2 if you feel it in your chest. So like that intense, anxious feeling, maybe it's palpitations, feel like you can't really like catch a deep breath. Type 2 if you feel like it's chest. Type 3, if you feel like it's in your stomach, so bloating, digestive pain, weight gain. I would say even like constipation or diarrhea, maybe a mixture of both. Type 4, if you feel it more in your pelvis, so more period issues, bladder issues, low libido. And type 5, if you feel it more in your joints and muscles. So aches, stiffness, autoimmune symptoms, that feeling of like, why am I sore? I didn't really do that much, kind of like an out of proportion of soreness to what maybe the activity that you did. Okay, so we have a 1 and a 5, a 1 through 4, 1, 3, 5, 2, 4. Yeah, type everything that it can be multiple areas. Head, yeah, difficulty concentrating. Cindy says 5 and 3. Yeah. So the area that you feel it most is showing, that's your body showing like where the inflammation is hitting you the hardest. And that gives us a good idea. Okay, what do we need to do to get to the root and start to reverse some of these things so that you feel better? You feel like yourself again. Carly says 1 and 2. Y'all can keep the answers coming. I'll keep the chat pulled up. Actually, I'm going to minimize the chat. Okay. So let's talk about this cascade again. So the triggering event and the stress, and this is something that most doctors miss. This is something that I was not really, I've studied all the medicines, all the pharmacology. I can tell you what pill is going to make you feel better, but as far as like studying the science behind why are we seeing this cascade, this is what's missing. So we get insulin resistance. The inflammation that those gut pathogens produce block receptors that leads to weight gain and sugar cravings, like intense sugar cravings. We'll talk more about that in a minute. We get thyroid suppression. Have you ever gone to your doctor and been like, please check my thyroid? I feel like something's going on with my thyroid. And then you get the results back and you're like secretly wishing or hoping that something is wrong because it would explain why you feel the way you do. And they're like, nope, everything looks great. And you're like, wow, now I feel even worse, that everything is fine. But we do get thyroid suppression. So the cytokines are inflammatory and they suppress thyroid function. This leads to fatigue and total like metabolic crashes where your weight starts changing even though you're doing nothing different. Then we see elevation in cortisol, and that just perpetuates the chronic inflammation. And cortisol steals progesterone, it blocks estrogen production. We call it the cortisol steal. So when we steal progesterone, guess what hormone becomes dominant? Estrogen. And you'll hear a lot about estrogen dominance. It's highly linked to breast cancer, uterine cancer, ovarian cancer, heavy periods, and this cycle just perpetuates itself. Here we go. I jumped ahead of myself, but estrogen dominance, the detox pathways get clogged, your liver is overwhelmed with all of this going on, estrogen builds up, you get severe PMS. And I literally cringe every time someone comes to me and says, I've been having really heavy periods, so they put me on a birth control pill. That is your body giving you a sign that something is not right. And a birth control pill on top of that is like pouring gasoline on a fire. So the result of all of this, what does all this make you feel like? You feel like a stranger in your own body and your labs look normal, which makes you feel even crazier, right? Okay, so let's talk a little bit about gut health. I want to see where you all are as far as your gut. So type into the chat and one, if you feel constant issues. So you either feel bloated or you eat something and you feel pain or you have irregular bowel movements, like pretty much a daily issue would be one that's constant. Two would be inconsistent. So maybe sometimes it's good, but sometimes it's bad. So maybe you have a bowel movement every day for a couple days and then you skip several days and it kind of goes back and forth. Or three would be generally healthy. So you go to the bathroom once or twice every day, you feel totally empty, you don't feel bloated, foods don't bother you. Amber said one, three. I think she meant one and two. So we see some threes. Oh, Carly, you're a three. That's awesome. Some twos. Two would be the most common. So sometimes things are good, but sometimes things can get wacky. One, yep, two. So lots of twos, a few ones, a few threes. Oh, Amber said one and three was for the last question. Okay. So you said two for this, right, Amber? Two for this. Okay. Awesome. Perfect. Okay. Y'all keep answering. So if you're below a three, your gut dysfunction is likely driving your hormone chaos. And honestly, even if you gave yourself a three, I can guarantee you that it's playing a role. A lot of people, even when they feel like it's generally healthy, it's not. And I've done hundreds of these gut tests, and I never found a test that's like great. I was actually really shocked by how bad mine was. So when it's compromised, it becomes a breeding ground for hormone hijacking pathogens. So when we get the gut dysfunction, the pathogen overgrowth begins. The pathogens release toxins. Those inflammatory compounds overwhelm your symptoms. We get the chronic inflammation. Hormone receptors are blocked, and then we get the hormone disruption, and that creates more gut dysfunction. So you guys see how it's just like a vicious cycle. So when I say gut hormone hijacking pathogens, you're probably like, what is she even talking about? What is a pathogen? So when I say pathogen, there are four big things that I'm referring to. Candida would be one of them. This is yeast. It feeds on estrogen and creates estrogen dominance. It's probably one of the most common things that I will see come up on gut microbiome testing. SIBO bacteria. So this is an overgrowth of bacteria in the small intestine. SIBO stands for small intestinal bacterial overgrowth. And this condition in particular produces inflammatory endotoxins that really drive up inflammation. It can also like affect your cholesterol and things like that. And then parasites, that's everyone's favorite. It's the most like intriguing. They steal nutrients for hormone production. So nutrients that you think you're eating all the good healthy food, and parasites love the good healthy food that you're eating. They love organic food. They don't like the environmental toxins or the pesticides. They thrive with that. And they literally are there ready to take and steal all of the nutrients that you are consuming before you even get it. And then H. pylori. So H. pylori disrupts stomach acid and affects your ability to absorb nutrients, break down protein, and that sort of thing. We'll talk more about this as we go. So hijacker number one, Candida or yeast. It's the estrogen feeder. So how does it destroy your hormones? It has actual estrogen receptors that feed on the hormones, and it produces a toxic byproduct that inflames reproductive organs. It blocks your liver detox pathways, and it loves sugar, y'all. It creates, I mean, literally unstoppable. You know that feeling where it's like, gosh, why can't I have more willpower? I just want sugar. And you feel like you're failing because you can't control yourself, or you feel like the willpower is, just not there. Sometimes it's sugar. Sometimes it's even just like carbs, anything that's broken down into sugar. That's what feeds it. And it sends signals to your brain all day long telling you to feed it. Okay. So the result is you're going to have heavy periods, PMS, breast tenderness, weight gain around your hips and thighs, sugar cravings, recurrent yeast infections I see quite often, and sometimes you'll get a white coating on your tongue. All of these are hard to eliminate. The reason that Candida is hard to eliminate is because it forms a protective biofilm around it and becomes resistant to standard antifungals, okay? Hijacker number two, again, is SIBO, so small intestinal bacterial overgrowth, and this is the endotoxin producer. And the way it affects your hormones is that it releases inflammatory LPS into the bloodstream, stands for lipopolysaccharide. LPS directly suppresses thyroid production. So even if your TSH is normal and you're looking at your TSH and your doctor says it's fine, SIBO will affect the thyroid. It creates insulin resistance and blood sugar chaos and produces methane gas that slows your metabolism. So classically with SIBO, we'll see extreme fatigue, particularly after meals. You'll have unexplained weight gain or inability to lose weight, brain fog, bloating after meals. So maybe you start the day feeling fine in your clothes, and by the end of the day, you look like you're 6 months pregnant. That's SIBO. You get metabolic dysfunction, and because SIBO hides in the small intestine, it's really hard for treatments to reach the small intestine. So it really does have to be a comprehensive plan to address these and get rid of them. And then parasites, everyone's favorite. They steal nutrients. This is an actual picture from one of my clients that has given me permission to share this photo. And I'm actually going through this right now. And let me just tell y'all, I don't ever tell patients or walk patients through doing things that I haven't done and tried myself. And I have been mind blown. If you guys follow me on Instagram or any of that, I post about this and I'll send you pictures and all that kind of stuff. But it's crazy, incredible. They steal B vitamins. So B vitamins are, you can be taking the best B vitamin ever. And if you have parasites, you're just keeping them very healthy. Magnesium, iron, and they release ammonia that damages reproductive tissues. Very common cause of autoimmune thyroid conditions like Hashimoto's or Graves' disease. And it can disrupt your sleep cycle because of how they feed. So if you always wake up between 2 and 4 a.m., highly possible that you have parasites. I always say, if you're a living, breathing human and you have ever had a pet, you've ever traveled, or you've ever eaten sushi, you have a parasite. So the result is that you get nutrient deficiency, induced crashes, unexplained fatigue, hair loss is a big one here, irregular cycles, and autoimmune thyroid disease. And they are hard to eliminate because, again, of all the hundreds of gut microbiome testing that I've done, it's very hard to see these parasites on a test. They are like posted up in the Hilton Hotel in your gut, and they don't come out onto the test. They do not want to be seen. So they can hide, and they have very complex life cycles. And last but not least is H. pylori. So this is an organism that blocks acid. And again, if you guys follow me or have heard me talk about things at all, blocking stomach acid is one of the worst things that you can do for your overall health. And this would include taking things like Prilosec and Tums and all that sort of thing. We have an acidic stomach for a reason. Specifically, H. pylori will destroy your stomach acid, and you need stomach acid to absorb nutrients. This is why patients on long-term acid blocking medications will become iron deficient, need iron transfusions. And they block B12, iron, and zinc. Those are critical for hormones. They create chronic inflammation in the digestive tract, and they disrupt protein digestion. So again, we have to have an acidic stomach to be able to absorb protein. So all of you women who have been, eating all the cottage cheese and the egg whites and the chicken and trying to get your protein up to a certain level, if you have these things going on and you don't have an acidic stomach, you're getting like half of that, if that, okay? So the result is that you get malnutrition-induced deficiencies, B12 anemia, low stomach acid, and actually low stomach acid will lead to heartburn, difficulty building muscle. And H. pylori is really hard to eliminate because it does burrow in the stomach lining. It creates these little pockets of alkaline, not acidic areas so that it can thrive and protect itself. So I want to know, this is another interaction, which hijacker you feel like is affecting you. And it may be several. That will be the last option. But number one, candida. So do you have sugar cravings, carb cravings, yeast infections, PMS, what you would consider estrogen dominance? Do you have SIBO? You have bloating after your meals, fatigue, brain fog, weight gain. Do you maybe have parasites, unexplained fatigue, digestive issues, or nutrient deficiencies? Type D, if you feel like it might be H. pylori, so heartburn, stomach pain, B12 deficiency, or protein digestion issues. And then E would be multiple, so several symptoms from several categories. Y'all tell me in the chat. Okay, E, 1 and 4, E. Okay, E, B, E. Yeah, a lot of them are multiple. I mean, most of us have multiple. Yes. Carly says A and C. Yep. Ashley says A and B. Cindy says E. I want to make sure I don't miss any ones. Yeah, Carly, I know you said about the last one, you feel like it could be too, like at certain times of the month. Yeah, for sure. Okay. So most women need comprehensive pathogen elimination, not just treating one infection. And that's something that we'll talk about. Okay, so here's another statistic I want to share with you guys. It always like blows my mind. But I mean, I am based on my population of women that I've worked with, like I'm actually surprised it's not a little bit higher, but 75% of women with hormone imbalance have undiagnosed gut infections that are creating chronic inflammation. So, I mean, I can't tell you all how many women I talk to. One is standing out in my mind in particular. She's hitting her macros. She's doing everything she knows to do. The scale won't budge. She feels inflamed. She's not building muscle. She's on hormone replacement therapy. And when we got all of her testing back and got things straightened out, she's lost 15 pounds. She looks like she aged in reverse 10 years. I mean, it's insane. Y'all make sure you follow me on Instagram and look at my client transformations. But every time I walk someone through this, I mean, my mind is literally blown. I'm like, oh my goodness, like it's just that powerful. And it makes me want to shout it from the rooftop. So that's why I do these webinars once a month. The pathogens do not just cause digestive symptoms. A lot of women are like, well, I don't really have that many stomach issues. Is it really still something like that? If you feel like you have anything hormone related, the gut is absolutely the number one place to look. All right, so what is the blind spot? Like, what is the reason we can't really get to the root of some of this? And why when you go to the doctor, are they checking labs and they're telling you everything's fine and they have nothing else to offer? Well, I don't blame doctors. Like I have been that provider. I've been in that setting for many, many years. And I feel passionately that the insurance and like the payers are really dictating what doctors are able to do. We have 15 minutes appointments with you, and I can't really do a whole lot in a 15-minute appointment besides prescribe you medication. Ashley, will you tell Lisa, put my Instagram handle in the chat? Thank you. So why are doctors missing it? Gynecologists, again, okay, they're seeing like 40 patients a day. You have 15 minutes. They're focusing only on hormones. They're not trained to look into the stomach part of things. So then if you mention anything gut-wise, then you're going to a GI doctor. They're looking only at your gut symptoms, and no one actually stops and puts the whole picture together. And then primary care, it's like, okay, we can check some vague inflammation markers, but what is it really showing us? And again, we're just limited, okay? And I feel like I can talk about this very honestly because like this is my world. I know how it works. And I think one of the saddest things we've done in the traditional medical system is divided up body parts into different specialists, and no one ever sits down and talks about the connection. You know, the human body is a spider web. It's not like your hormones do their thing, your stomach does its thing. It just doesn't work like that. They never test for comprehensive gut pathogens, blood work with inflammatory levels, and if they do, it's just very basic, and you know, it's kind of hard to know what to do with that information. Hormone metabolites and ratios, and then the root cause connection between all three of the systems. It's really like trying to solve a puzzle when you're only using one piece, okay? What I want you to know is that you're not crazy. You're not just getting older. You're not weak. I want you to type into the chat if you ever feel like either doctors don't take your symptoms seriously, or not just doctors, but like if you feel dismissed when you're describing how terrible you feel. And sometimes, again, like it's hard to really put it into words. It's just you don't feel like yourself. Something's off. Type 3 if you're told your labs are normal when you feel awful. And 4 if you feel like you're losing your mind because no one understands. So type in the chat 1, 2, 3, or 4. You can type all of them if you feel like it's all. Just want to see where you guys are with this. Okay, Lisa, Ashley Sherlock put my Instagram handle in the chat for you. And then other Ashley says 1 to 4. Yep, 4. Carly says 1 and 3. Yeah. Dismissed. Yes. Yeah, I know. And I worked in primary care, so I was the one who like got all the patients and I'd send them to the specialist expecting some sort of help. And it's like, oh no, we don't know. Go back to your primary. And then it's like, well, I don't know what to do. What will your insurance cover? And how much time do I have with you? And yes, I get that referred back to primary. Yeah, so your symptoms are real. This triad is real, and there is actually something that you can do about it. And we're going to get into that. So I love this because I want you to actually apply some of the things that we've been talking about. We're going to do an assessment, and this is going to help you measure your, it's a hormone assessment. So we're going to kind of see where you are. Ashley Sherlock is going to put the link in the chat to it's thrive9.life with my Emmy Hearts. And we're going to take the hormone assessment to get your baseline score. Okay. So click on that link that Ashley just put in the chat. We're going to take a few minutes to do this. And when you click on that link, you're going to click down at the bottom where it says, because unless you've attended one of these, you don't have an account. Or if you are a client of mine, you may have one. So either sign in if you've already done Thrive9, but if you're new, most of you are, click sign up at the bottom. It's going to ask for your name and make sure you put your gender. Okay, it's going to ask for your gender. Make sure that you put your gender so that it gives you the right assessments. Okay. So everyone work on doing that. If you have any issues, please let me know. I don't want to get hung up here, but I want to help you guys get in so that we can get some data, okay? And see where you are. Once you do get in, you're going to click on the women's hormone assessment that this arrow is pointing to, this big red arrow. Yep. If anyone is having any trouble, let me know in the chat. When you get in, if you can type in the chat that you're in and you're taking the assessment, that would be awesome, just so I know time-wise how much time to give you guys. Thank you, Ashley. Carly's in. Yes, you can, Lisa. You can do it after. You sure can. And I am recording this, and I'll send out a recording because of course, like, lots of people register and can't attend. Amber, that's fine. You can do it after as well. If you do get in and you have time to do it right now, click on the women's hormone assessment and take that. And it's going to give you a score. I'm going to go ahead and go to the next page just so you can see the score. What I want to see is what I want to know after you guys have done it is what your global score is. So type that into the chat after you get that global score, okay? So I do want to just point out on this assessment, remember that I think sometimes when we say hormones, we think we're just talking about like estrogen, progesterone, testosterone, but you have tons of hormones. So we're looking at thyroid, we're looking at the adrenal hormones like cortisol, we're looking at insulin and like metabolic health. So we're looking at several different areas, not just female hormones or sex hormones, we call them, like estrogen, progesterone, testosterone. But the global score at the top is going to give us the overall impact and level of dysfunction. So I know Carly and Ashley are in and taking the assessment. So when you get your scores, girls, let me know what they are. Okay, give y'all a few more minutes. And if you don't have a score right now or you can't finish it right now, that's totally fine. But I like to see where you all are. So if you can, let me know. Carly, if you're still here, will you pop in the chat and let me know like how many questions? Okay, yeah, that's fine. If you're having trouble with registration, just let me know if you need help afterwards and I can help you, but I don't want us to get stuck here. Okay. Your score was 38, Carly? Okay. Yeah, okay, here we have some scores. So 38, 25, 49, and it's probably showing you like which, section you're higher in. Awesome. Okay. And for those of you who haven't taken it yet, oh no, okay. Question 38. Okay, that's fine. Keep going. I don't want to rush you, but some of the scores are coming in. I'm going to go through this slide real quick just for those who aren't taking it and are listening in to keep us moving along a little bit, but we will want to make sure we don't only just take the hormone assessment. We want to take the inflammation assessment and the gut assessment, and doing all three of them really helps us put the whole picture together. And I always want to make sure that we're looking at and measuring as much as we can, because we can't solve what we're not measuring completely. So these are assessments that you don't need to do them right now. Nobody needs to do these right now, but at some point doing them um, will be helpful. Yes, that sounds perfect, Amber. No worries. Is everyone else who was taking it, are y'all done? I don't want to keep talking if y'all are still trying to take the quiz, but okay. I'm going to go ahead and keep moving on. You guys finish the quiz or the assessment, anyone who's still doing it. But really, I mean, what I feel like I want every single woman to know is that you don't have to feel this way, and there is an answer. Okay, awesome. Amanda has 72. Y'all keep the scores coming in. You can have stable energy throughout your entire day. And if you don't, and if you have any of these symptoms that we've talked about today, this is not like a character flaw or just the way it has to be. This is your body's cry for help. Okay. This is the fire alarm that's going off, and we don't just want to turn off the alarm without putting out the fire. You can lose weight. You can get rid of the stubborn middle weight. You can have mental clarity. You can be sharp and emotionally balanced and not feeling like you're doing mood kind of things all day or throughout the weeks of your cycle. You can have easy periods. A painful period is your body giving you a sign, and you can feel vibrant. You can feel confident in your body again. You can feel like yourself again. And I want every single one of you to know that it isn't just possible, it's actually probable when you address the three parts of the triad that we've talked about today. So I had told y'all before, Carly said she got a 57. Awesome. Thank you. I mentioned earlier that I work one-on-one with a lot of my clients doing the in-depth testing and helping them heal from the inside out and getting to the root cause. I want to be able to help more people. And I have put together a 6-month course that I'm going to walk you through right now. And it's not just cost effective, it's the exact framework that I walk higher tier clients through. Okay. So in month one, we do the assessments. We do the rest of the assessments that you guys didn't do today. We map out what pathogens we see. We look at stress, inflammation control, and replacing micronutrients that a lot of these pathogens have stolen. In month two, we start the fire extinguishing. So we do acute inflammation reduction, we repair the gut barrier, and we rebalance the nervous system. In month three, we work on pathogen elimination. So we really target parasites or yeast using antimicrobials to get rid of the pathogens that are there. In month 4 through 6, we're doing restoration. So month 4 is hormone restoration, where we optimize hormone balance. We've cleaned up the gut. We're supporting the liver and the thyroid and adrenal glands. And then month 5, we're doing microbiome rebuilding. So restoring the good flora, continuing to heal the gut lining and eliminate food sensitivities. And then in month 6, we're talking more integration and prevention, long-term wellness protocols, sustained stress resilience. So it's completely addressing the triad from the ground up. Okay. So in the 6-month program that I have put together, you're going to do all 3 assessments, and there are 3 additional assessments that we can look at together as well. You get custom supplement protocols. Now, those of you who did this assessment and those of you who will go back and do it, it's going to come up and tell you, like, if you got a high score, it's going to say you need like 25 supplements. You don't need 25 supplements. I don't want you to order all of those. I want you to go through this program and or work with me, and we'll figure out what your body really needs. But that is just a general guide. That is not like you need all that stuff. Just FYI, it can be kind of confusing. Um, but you're going to get custom supplement protocols in the program, and then from me. We do monthly progress reviews. We're going to do phase by phase elimination guides. You get access to a private app with practitioner access. That's me. We do monthly group coaching calls so that I can meet with you guys, make sure you're taking steps forward, that you're taking the supplements you need to take, but also doing the lifestyle things that you should be doing. I am not in I don't like to just replace a prescription cabinet with a supplement cabinet. Okay. So I want to use a very targeted supplement approach. This is not all about supplements. We do bi-weekly live education sessions, and you get 72 training videos. So you get a video 3 times a week. It's 8 to 10 minutes long, and it's walking you through step by step. Okay, this is what we're starting with. This is what we're going to now. It is so straightforward and so easy to follow. Does not take a lot of time. I have 3 kids. I wanted to make sure that it was really friendly for people who have a lot of things going on. Okay. And you get 24/7 community support. It is $99 per month, and you can cancel anytime. That's on a next slide. But like, I am not here to sell you something. I want to show you, I want to give you some answers and show you what the real drivers of this is. And I want to show you options for being able to work together. And this is the most cost-effective way to be able to work together. So I want to know in the chat, how ready are you? Are you desperate? I mean, I talk to women on the phone and they're like, I cannot be like this another day. Like, I need you to help me. So are you like at your breaking point? Are you ready? So you're committed. Are you still questioning? And that's totally fine. I want you to be honest, and I want to answer any questions. Okay. So tell me like where you guys are at as far as readiness. Okay, Amanda says desperate. Ashley says ready. Sorry, let me go back. Just got ahead of myself. Okay, so desperate, ready, or unsure. Any of those are fine. Just let me know where you're at. Carly says ready. If you are unsure, type unsure. And if you have any specific questions, please ask them, because I like to talk through it. It's so much easier to talk through this in this setting. Anyone else? Desperate, ready, unsure. Tell me where you are. 3, I'm assuming 3 means unsure. And that is totally fine. I don't want you guys to feel like, oh, I can't be unsure. If I was being presented this for the first time, I'd probably be unsure too. So ask questions. Cindy says desperate but broke. Okay. Yes. Okay. That's unsure. Okay. All right. So if you are here today, you can, Amanda says, same as Cindy, $47 your first month to try it. Okay. It's a trial, 47, but like y'all, that's like the cost of coffee at Starbucks with like some of their food, $47. Okay. Let's go over what you get immediately. And I will say, you know, I work with clients and like doing more of the testing and things like that. And it is, I mean, I feel like as women, like it's hard to spend money on ourselves, but also like if we want to feel better, we have to be able to invest something, right? Um, you've probably tried a lot of free things that, like aren't working. So you're going to get the assessments, you get access to the full 6-month program, you get an onboarding call with me, you get the private channel app support and the monthly group calls. You can cancel anytime. Again, like I am not here to have you sign any contracts. I hate contracts. I'm not here to like sell you anything. I want to let every woman have the opportunity to feel better and get to the root of some of this stuff. Carly, yes, I do take HSA payments. I don't know that HSA would cover the course. It probably would have to be like more of the one-on-one. Um, but we can talk about that. Just get with me afterwards. I will share Debbie's transformation. She's 50, mother of two, business owner. Before the program, her inflammation score was 68. She was exhausted by 2 p.m. She had gained 50 pounds. She had severe PMS, brain fog, and her labs were perfectly normal at her doctor. After 6 months, her inflammation score is now 14. She has sustained energy morning to night. She lost 22 pounds and she has normal cycles that are not incredibly painful. Her business is thriving and all of her biomarkers are in the optimal range, not just normal. I'm not going to go through all this, but these are some of the things that we found with her. So what happens if you don't like, okay, it's an expensive time of year. We feel like we're broke. Like, what happens if you don't address this? We have inflammatory damage that accumulates in the organs. The pathogens multiply. They're not going away, y'all. I mean, until we address them, they're multiplying and they form stronger biofilms. We get more hormone disruption. It becomes entrenched. Your symptoms worsen and new ones appear. Vitality continues to decline. It does not get better on its own. It only accelerates. So I always tell people like the sooner we can start working on this, the better. Okay. How important is it for you to feel amazing again? Do you desperately want it? Is it very important or it's important? Put that in the chat if you can. I want to talk to the women who are like at a 9 or 10. Like, I don't want to spend another day feeling like this. I'm ready to feel better. So tell me where you're at. Okay. Ashley says 10. Amanda says desperate again. Yes. Oh, gosh. Who else? Where are we at? How bad do you guys want to feel better? Again, I'm not going to go through all this. Carly says a 10. All right, so $47. This is just for the webinar. If you go to my website, I'm going to actually share my website, my services page in just a second, because a lot of people ask like, okay, how can I work with you one-on-one? How can I do more testing? So I'm going to show you guys that in just a second. You can cancel anytime. All right, let me stop my share and share my services page real quick for those of you who want to see that. Okay. So this is my website, and Ashley will post it in the chat. EmmyHeartsNutrition.com. You can read all about me, what my philosophy is, that sort of thing. And these are the different tiers of like client options that I have available. So a lot of my clients fall in this middle tier where we're doing comprehensive functional blood work, and I will throw in a gut microbiome test here. It is my favorite test to look at. we're looking at the candida, the yeast, looking for any parasites, and it gives us like on paper, okay, this is the data, this is what we need to work on cleaning up. Signature plan is like for people who are really ready to commit. They are tired of trying different things. We're doing all of the functional testing that includes like the hormones and cortisol and genetics and all that sort of thing. But if you do the 6 month course on any other day, it is $99 a month. And so I want to reward those of you who are here today by making the first month $47. And then after that, it goes to $99 a month. Again, you are not signing any contract. I'm not locking anyone into anything. I want it to be helpful for you. I want you to get an incredible outcome, and I want you to tell all your friends. Like that's how my business works. So Amanda, if you do what we are talking about today, the essential plan with doing the course, you will not do any blood work. But if you do want to think about doing blood work, I'm so used to having people who like get lightheaded and things like that. So there are ways to work around that. But I just want to show you guys, if any of you are like, okay, the course sounds great, but I want more help. I want more one-on-one guidance, and I want the data on paper. I want to see what's going on in my gut. I want to have the thorough blood work done. We can talk about the elite or the signature plan. If you are interested in one of those, I would like to talk to you on the phone. So Ashley is going to post a link to my discovery call calendar. So that's a free call, but we really would just talk through like which plan is best for you if you're interested in more. And if you are, let me know here in the chat because I've opened up some time on Friday and Monday for webinar attendees, like if they specifically want to do a discovery call and talk about some other options. But I just wanted to show you guys the essential plan is the course. That's what I presented with the webinar today. It is $47 for you today. The regular price is $99 a month. So questions. Ashley would like a discovery call. Awesome. Okay. Ashley, can you can you share your email address and I will email you and we will set something up? And for those of you who are listening to the recording when I send it out tomorrow or the next day and you want to do a discovery call, please let me know. Reach out to me. And Amanda, okay. Okay. That was, I know I flew through those last slides, but it was kind of the same stuff. The end conversation is that I want every single one of you to have access to what I know works. And I don't want anybody to feel like the symptoms that they have are normal and that they have to like push through because it is absolutely not the case. And I would just say like the sooner you get on top of it, the sooner we reverse this. I mean, when we talk about the significance of the gut microbiome is going to become, oh my goodness, is really becoming, it's been around for a long time in the functional world, but it's becoming more talked about in the conventional medicine setting and how it relates to, yes, Amanda, if you could still fill that out, that would be awesome. That just gives me an idea what we need to cover. That'd be fantastic. Just don't pick a date because I'll get you in sooner. My calendar is like fully booked for the holidays, but I'll get you in sooner. The significance of the gut microbiome in conventional medicine really is slowly catching up, but the effect on mental health and weight. I mean, we do studies on lab rats, and when we transplant one type of beneficial bacteria from an obese mouse to a lean mouse, the lean mouse becomes obese and vice versa. I mean, what's growing in your gut and what is there is like 99.9% of the time, that is the root of so many things, autoimmune conditions, allergies, like all of it. If there's anything that I feel like I would stand at the top of a mountain with a megaphone and say, you don't have to feel this way and look at your gut, is absolutely what I would tell you. So that's just my 2 cents. I hope you guys learned a lot today. Does anyone else have any questions? Does anyone else want to schedule a discovery call? Ashley, you can also click on that discovery call link that was posted and fill out the form. That'll give me like your phone number and everything so I can be in touch to set that up. Lisa, did you have any other questions? Who else is here? Cindy, Barbara, Karen, anyone have questions about anything gut related that we talked about? If anyone has a copy of their recent labs, just like even standard labs from their doctor, I always love to look at those because there's a lot of markers on there that when I look at them through a functional lens, it can really tell me a lot about what's going on. So this is y'all's time. Take advantage of me while while you can if you have anything. Yes, Amanda, we can definitely um do you have them like in front of you? Can you do you want to type some things in the chat and I'll or you can just send them to me and we can talk about it on your discovery call as well. Any questions before we wrap up? Carly, do you have any other questions? I can reach out to you too about the FSA. I have a lot of people who can use the HSA, FSA for the one-on-one services, so like the Elite or the Signature plan. But I haven't tried it yet with the course, and I like to be really just like careful because every like company has different guidelines and stuff. So that's something that we can kind of talk about. But Lisa says, how do you support postmenopausal women? Okay. So, um, I don't know if you have any other like more specific question, but the gist of that answer would be, so I love to work one-on-one with women. So I find that like, we're busy. We work, we have weekends, we have dinners out, we have travel, holidays. So one of the biggest things that I do is I really like hold your hand through life and figuring out, okay, what nutrition is best for you. Of course, I love using the functional testing. So looking and seeing, okay, what's going on in your gut? Let's clean that up together. Here's how we're going to do it. That's going to be nutritional changes, targeted supplements, lifestyle kind of things. A lot of us need some nervous system rebalancing. We live our lives in fight or flight, and we don't know how to come out of that. So a lot of it is that sort of thing. And when we do it that way, when we use the functional testing to make sure everything is in balance, you're going to feel so much better from a hormonal perspective. So, does that answer your question? So, general women who believe no hormonal health is required postmenopausal. So, who believe no hormonal health is required postmenopausal? Do you mean like, are you talking about like hormone replacement kind of stuff? I don't do hormone replacement therapy. That's something, my approach is giving your body the tools that it needs and having everything in balance so that you can balance your hormones naturally. Not that I'm against using hormones in certain situations, and a lot of clients I have will work with me and also have their doctor, and we collaborate and that sort of thing. So achieving the balance, seeing what's going on in your body and giving your body exactly what you need, like that's the best recipe. I talk to so many people who've like tried what their mom did or their sister does or their friend does. And it's like, or all this random stuff that Instagram is feeding you or TikTok is telling you you need this supplement or that supplement. It's like, no, we need to look at your body's blueprint and figure out exactly what you need. And I mean, that's the recipe for success. So that was a lot of words, but did I answer your question? And if so, do you have any other follow-up questions? Okay, yeah, she said I did. Awesome. Anyone else? Questions, comments? It can be questions about like the clinical aspect of things, about your situation, about what options to work together looks like. Okay. Carly, is that marker that tests the parasites called anything? Okay, so if you have a copy of your labs that you're looking at, look at eosinophils. It'll be like two different numbers. It'll say like eosinophils absolute and eosinophils and be a percentage. So the percentage is what I would like to see. That's a big indicator of parasites. Anything over 2% would be indicative of that. Definitely anything over 4% would be like a train smash. I mean, Amanda having trouble finding labs, but can when we talk. Yes, that's perfect. Let's see. So Carly, if you find that number, let me know what the percentage is. And if anyone else has any questions, please type them into the chat. I'm gonna. Okay. Yes, if you're gonna have labs done in January, we'll check that. There's other markers that I'd want to look at as well. So that's something if you do the $99 program, like with the discounted first month, and you submit your labs to me, I'm happy to look at them and give you my feedback. Also, when we have our group Q&As once a month, a lot of people will bring labs, like we'll talk through all that. So there's a lot of touch. I'm trying to have there be as many touch points as possible for you to both like get the result at a really reasonable investment and still make it personal and like feel like I would love to work one-on-one with everyone, but I understand that just from a budget perspective and just there's only one of me. There's, I don't have time to take on everyone, but um I try to have as many touch points as possible to make it as personal to you as possible. So okay, Carly says, yes, that's what I would like to do. Okay, so Ashley, go ahead and put the Ashley Sherlock, go ahead and put the link for the deal today. So the $47, Ashley's going to put that in the chat. The link, if you want to go ahead and sign up for the program and you want to snag the $47. I've done another one of these webinars, and afterwards, people were like, "Can I still get the $47?" And I just have to like, I want to give everyone everything. I want to do all of this for free because I want to help you all. But um I feel like if I do that, I'm not like standing by my word and there's no benefit for you guys. So the $47 literally is only for today with this link, okay? If you go to sign up later, it's $99, okay? Lisa says, tell me more about the supplement support. So depending on if we're doing any testing, so one of the higher tiers, I look at the test and I recommend targeted supplements. If you are doing the program, we're going to walk through setting the foundation, replenishing nutrients, making sure your stomach acidity is where it needs to be, and you're going to take assessments as you go, and I will give you some guidance as far as what we're doing, what I want you to do supplement wise. Okay. That's also something that if you do the program, we're doing a 15-minute onboarding call. So we can talk about some of that then. That's also something we can talk about at the group Q&As. But if you're interested in a higher level of support where we're doing testing and it's you and I working one-on-one together, I tell you exactly what I want you to take, when I want you to take it. I send you like a pre-filled cart. Like it is, there's a lot of guidance there. So let me know like which option are you looking at maybe a higher level of support? Or are you looking at the $99 program? And if you're looking at one of the higher levels of support, we can get on a discovery call and talk through some of the supplement support stuff too. Perfect. Ashley posted that link. Carly, Ashley posted the link so you can follow that link. I'm going to go ahead and stop the recording.